Meaningful monitoring for people with type 2 diabetes. Why, when, and how often to self-monitor.
To stay in my target range, I need to know what's going on, right? So, how do I find out what affects my own personal blood sugar level?
If you check it at set times of day for a few days and record each reading in a blood glucose monitoring diary or phone app, you'll start to get a picture of how your blood sugar varies with what you eat and do.
How much do you have to record? How often?
Really, it's about checking at the most useful times, neither too much nor too little. Too much can be overwhelming, and too little won't give you enough information. Your healthcare team will help you sort out when.
Typically, though.
Well, at set times, before and after meals, or before and after exercise, for example. Some people are asked to check 4 times a day for a few days each week, or it could be just for a few days before a clinic review.
And I record every reading, do I?
Yes, along with what you've eaten and drunk since the last entry, and any activity and the medication you've taken, or missed, come to that. That way you can find out what affects your blood sugar levels, which is really useful to know.
Useful how?
Well, say your blood sugar rises after eating or drinking certain things, or more than you usually do. Knowing that, you can start thinking about alternatives.
Why record my activity, though?
Because activity can help to reduce blood glucose levels. Your diary can show how well your diabetes medication is working too.
What about if my blood sugar is still too high or too low?
There's lots of options. Your healthcare team may start you on medication, or increase the dose, or switch to another medicine. Other things can also raise your levels. Feeling stressed or unwell, for example, or recovering from an operation. So can some medications such as steroids, especially in the daytime.
Do the checks pick up on low blood sugar too?
Absolutely.
Does everyone with type 2 diabetes get hypos?
No. It can depend on your medication. But if you're advised to, it's really important to check your blood glucose in certain circumstances, like before driving.
So I know if I need to eat something first.
Exactly. And recording all your regular self-monitoring readings in your diary or phone app, along with the other information, helps you and your healthcare team to understand your diabetes better.
Knowledge is power and all that.
Visit the website to watch all the videos in our series to help you understand how to manage your diabetes.